Okay, well, my name is Hunter Kutrosh, and I did my research paper over leukemia. Leukemia is one of the most common types of cancer in the world these days, and millions of people are affected by it each year, and it's just getting worse and worse as we get older. It is just kind of a cancer that forms in the blood forming tissues of the body. It usually starts out in the bone marrow and then gradually works its way through the lymphatic system. Um, there are many different types of leukemia that exist, and many different types that affect children, and there are many different types that affect adults. And the different types kind of vary on how fast they are and how slow they are too. So we will get into that a little later into this. A couple of the types that I will talk about in this video are acute myeloid leukemia, chronic myeloid leukemia, acute lymphocytic leukemia, and then chronic lymphocytic leukemia. And those are four of the main types of leukemia that are pretty common these days. It's a very rare type of cancer, and each type kind of the rarity differs between each type, and it can be very deadly if it is not treated early or diagnosed at an early state. Just a little overview of leukemia. It's like I said before, it starts in the blood forming tissues in the bone marrow and the lymphatic system. There are a few types that are more common than others. Basically, how it starts is it spreads throughout the body by basically starting in the blood forming tissues, and then it starts in the bone marrow, and then once it gets through the bone marrow, it starts and moves to the lymphatic system. It forms in the body's spongy inside of the bone marrow. That's where it first starts, and this causes genetic mutations to the DNA of the blood cells. It starts out as immature stem cells in the interior of our bones, and then the DNA of our cells is supposed to give instructions to our cells about when they die and when they grow. Basically, it will continue to take over cells, and it will divide, and basically these cells will divide and they will never die. Like, they will keep dividing and keep overpowering the other cells that are inside of our bone marrow and inside of our lymphatic system. The only way for these cells to die is by treatment, which will help take over these cells or force them back out. The stem cells can either develop as lymphoid cells or myeloid cells. There are typically two types of lymphocytes that are involved with the leukemia, and the two types would be B cells and T cells. B cells are responsible for producing the antibodies that attack bacteria and help protect us from infection of our body. T cells are responsible for alerting the other cells of infection in our body. So those B cells and T cells are very important in our everyday life and very important in our body's function, because when leukemia starts and it starts to force these B cells and T cells out and take over these cells, then our body has no way of fighting infection or no way of knowing when infection enters our body. Basically, then the DNA genetics of our bone marrow and the stem cells mutate, and then they start to spread throughout the body. When they are spreading throughout the body, they crowd out the healthy cells within our body, which, back to the T cells and B cells, basically leukemia, when it spreads, it is crowding out our T cells and our B cells, the cells that we need. Basically, and then these cells will multiply and multiply, and they can gather in our liver, our spleen, our lymph nodes, and our skin. And when they gather in these spots and they build up a lot of leukemia cells in these spots, that can be very bad for our body. There's a lot of different symptoms that come with leukemia, like a lot of symptoms you can find early, but there's also these symptoms deal with a lot of other things that go on that may not be leukemia. So, I mean, symptoms range from fevers, chills, body aches, bone tenderness. Some of the most common symptoms are fatigue, weakness, shortness of breath, excessive sweating, especially while you're sleeping. Those are kind of the main ones. Some of the worst symptoms, severe infections, easy bleeding, bruising really easily. You might get red spots on your skin, and you might feel your lymph nodes enlarged. They might be swollen, or maybe your spleen or your liver is swollen. The thing to worry about with these symptoms is making sure that, like I said before, that you don't oversee them, because these symptoms are part of other diseases and other things that may not be leukemia. So if you do experience this stuff, you should go see the doctor or should go get it checked out. A lot of these symptoms are very common, and you should definitely not wait to go see a doctor if you experience any of these symptoms. Like, the first thing you should do is go see a doctor, because you never know. It could be leukemia and it could be something else. You have no idea. Basically, the most common way leukemia is found when people don't know they have it is when they go in to get blood work done. And then when they go in to get blood work done, the doctors see that they have leukemia cells in their blood. And that's how you tell that you have leukemia. Now, I said the 4 different types of leukemia earlier. Now we're just going to kind of go into depth a little bit more about them. The first one is acute myeloid leukemia, or AML. It's basically just a blood cancer that starts in the bone marrow and can progress throughout the body very fast. These types of leukemia, like acute myeloid leukemia, acute means fast, so that means it's a fast spreading. So you want to figure out how to stop it as fast as you possibly can, because it spreads very rapidly. Our body basically produces white blood cells called myeloid cells, and these cells typically develop into mature blood cells in our bone marrow. And these myeloid cells can develop into 3 types of cells. They're red blood cells, white blood cells, or platelet cells. And they transport oxygen, fight infection, and help your blood clot properly. And what happens with acute myeloid leukemia is your bone marrow makes abnormal white blood cells. And then it causes your bone marrow to crowd out the healthy cells. And then you may experience bleeding, infections. People experience anemia, which is a decreased amount of red blood cells, which can also cause there to be a less amount of oxygen in your blood. And it can spread. Mainly, it spreads to the brain, the tissue, and other organs, causing tumors if it spreads fast enough. The next one we'll talk about is acute lymphocytic leukemia, or ALL. It is another type of leukemia that can spread throughout the bloodstream. Basically, it starts the same way as acute myeloid leukemia. They all kind of start the same in the bone marrow, and just kind of spread that way. It crowds out the healthy cells. One of the main things that ALL and AML have in common is that they can spread very quickly. Like I said before, acute is fast, so it spreads very quickly. ALL is more common in children under the age of 15, but is most common in kids 3 to 5. It can show up in some adults, but it's very uncommon. ALL is treatable in children, and in most cases is completely resolved. So if you do find in children, there's not a lot to worry about. Most of the time it will be cured, but just make sure you get in and get it checked out. On the other hand, basically adults who get ALL, it's very hard to treat adults because there's not many adults that get it, so there's not a lot of research on it. So it is harder to treat and manage adults that get it. most researchers believe that ALL is due to a genetic mutation that affects the blood cell protection or production. Sorry. Some of the symptoms of ALL are easy bruising and bleeding, infections and fever, about the same as acute myeloid leukemia. I mean, all of the symptoms are going to be the same. It just depends on how fast you receive these symptoms. The next one we'll talk about is chronic lymphocytic leukemia, or CLL. This starts the same as the other two. What makes CLL different is that it can also lead to a condition called diffuse large B-cell lymphoma, or DLBCL. It can spread very quickly throughout the bloodstream, but it's chronic because it's slower than acute. So it won't spread as fast, but it can still spread very quickly. It responds very well when treated too. It can cause cancer in the lymph nodes and in the bloodstream if it's not treated. If this occurs, it is called small lymphocytic lymphoma, which is essentially the same thing as CLL, just in different locations. So CLL is most common in the older generation. So, I mean, people around the age of 70 usually get CLL. And that also due to the fact that it takes a while to show up. Like, that's why it's chronic. So it takes a while to show up. They believe that CLL is caused due to genetic mutations of the genes that control the growth of our bone marrow cells. So that would be the difference between CLL and ALL. And basically you will experience enlarged lymph nodes in the neck, the groin, and then fatigue and fevers. And those are the most common symptoms. But like I said, any of the symptoms I talked about earlier, those are all part of leukemia. But they could be also part of something else. Chronic lymphocytic leukemia is the most common type of CLL, and T cells make up the least amount of cases of CLL. So, I mean, the severity of CLL can differ between stage 0 to stage 4. I mean, doctors use these stages to describe the severity of leukemia and how far it has spread throughout the body. So the certain stages also determine the amount of treatment you will receive, if you receive any at all. Like stage 0, you might not receive any treatment, but once you hit stage 3, stage 4, that's when you're going to want treatment. That's when they're going to start treating you. The first type of treatment is targeted therapy. I mean, this is a type of treatment that they use drugs and medication to kind of target one area of where the leukemia is at. Chemotherapy is also another type of therapy that they will use, which is received by a pill or through the vein, which can kill the cancer cells in the body. The fourth type of leukemia we'll talk about is chronic myeloid leukemia. It's also known as chronic myelogenous leukemia. This starts out the same way as the other three. It starts out in the myeloid cells, and which those myeloid cells make up our red blood cells and our platelet cells and our white blood cells. I mean, there's a genetic change to the myeloid cells when they are immature cells. So this causes the red blood cells, white blood cells, the platelet cells to mutate and change to leukemia cells. The genetic change causes the myeloid cells to form an abnormal gene and later become CML. These cells start to form and grow in the bone marrow, causing an overflow of the cells, forcing the healthy ones out, just like the other three types. It's most commonly found in adults, but rarely found in children. So the most common age diagnosed in adults is around the age of 65, with the average being 64. And now we're going to talk about some statistics of leukemia. It is a very severe disease. Most people don't know that there's different types that are rare and affect different age ranges. So your acute lymphocytic leukemia, in 2022, there will be about 6,600 new cases of leukemia and then about 1,500 deaths. This is a very high number considering that we're only 2 months into 2022, and that's already the numbers that we've noticed. There will be about 60% of the cases of ALL will occur in kids, and it is more reactive in kids under the age of 5, but doesn't show up in people until around mid 20s to 50s. So around 20 to 50 years, I mean, that's when it really shows up. The next one we'll talk about is AML. In 2022, doctors and researchers estimate there to be about 20,000 people that will be diagnosed with AML, which is a very big number. There will be an estimated 11,000 deaths from AML, which AML is uncommon in people under the age of 45. I mean, the average age of people being diagnosed with AML is 68. The survival rate for AML has increased very slowly to about 30% though over the last few years. AML is more likely to develop in men and older adults. So older women are still able to get it, but it's more likely to show up in men at younger ages. Next one we'll talk about is CLL. Doctors and researchers estimate there to be about 21,000 cases in 2022 and about 4,300 deaths. Every 1 in 4 cases of leukemia will come back as CLL, or chronic lymphocytic leukemia. CLL is less deadly than most of the other cases. I mean, as you can tell, the cases that will be found compared to the deaths is way different than AML. So, which is very good because we want a very high survival rate, which the survival rate of CLL has increased 86% since 2017. So that is a very good number. Most people that are diagnosed with CLL are not diagnosed until the age of 70. And rarely people under the age of 40 will be diagnosed with CLL. CML is the next one we'll talk about, and is typically diagnosed around the age of 64. However, most people diagnosed are over the age of 65 years old. Statistically, 8,000 new cases of CML will be diagnosed in 2022, and about 1,200 deaths will be of CML in 2022. Chronic myeloid leukemia makes up about 15% of all the new cases of leukemia in humans, and about 1 in 526 people would be diagnosed with CML in a lifetime. Some different types of treatments we'll talk about. Targeting therapy is basically, like I said before, targeting a certain area of the body and trying to cure that area. Then you have your radiation therapy, which is uses X-ray machines and forms of high energy to kind of destroy the leukemia cells in your body. They'll just basically have you lie down on a table and either do X-rays or some kind of radiation sent through your body to help kill them. And then another form of treatment is a bone marrow transplant. This consists of basically just replacing the old stem cells in your body with new healthy stem cells or bone marrow cells. And this will help regrow more bone marrow cells in your body. You will have to receive stem cells from a donor though. You will not be able to use stem cells from your body. You'll have to get them from a donor. Or other people will usually do chemotherapy or radiation therapy to try and cure the cancer before they will do a bone marrow transplant. Basically, they'll use a long needle, and that's how they do the bone marrow transplant. They'll put new bone marrow into your body, into your bones. Leukemia is diagnosed by many different ways, I should say, sorry. It can be, like I said before, it can be diagnosed as fast or slow throughout types that spread throughout the body. Chronic leukemia is basically diagnosed as a slower type of leukemia. There are many different types of chronic leukemia, but I only talked about the 2 that are most common. It involves mature blood cells of our body. The cells basically grow and replicate a lot slower, allowing the development to take longer. So it takes longer to show up. There are some types of chronic leukemia that show up no early signs, but can be undiagnosed for years. The other way to classify leukemia is by finding out what types of white blood cells are affected. Lymphocytic leukemia affects the lymphoid cells, which form the lymphoid or lymphatic tissue. These types of tissues are what make up the lymphatic system. Malignant leukemia is a type that affects the myeloid cells in our body. These cells are what help produce the red blood cells, white blood cells, and platelet cells in our body. Diagnosis would be, or basically diagnosing leukemia, it's pretty hard. It's a lot of different tests that people have to do. There's only a few ways that doctors have found effective to diagnose leukemia. The first one is by doing a physical exam of the body, checking out all their lymph nodes, making sure nothing's swollen, doing a liver test, a spleen test, making sure nothing's swollen. Some of the things that they might look for are pale skin, swollen lymph nodes, enlarged liver and spleen, like I said before. And then another way of diagnosing leukemia is by checking the blood cell count. If there's an abnormal amount of white blood cells, platelet cells, red blood cells, this could be showing that there could be leukemia. There are many times where the leukemia cells stay inside of the bone marrow, so this will make it harder to see that you have an abnormal amount of cells. And then the last way of diagnosing leukemia is just basically by doing a bone marrow test. So with this, they take a long needle and they stick it into your bone, and they'll pull a bone marrow sample, and they'll check that to test the blood cell counts. And then just basically some things to kind of look out for, some things that can increase the probability of you getting leukemia. Could be a person having previous cancer or receiving types of treatment for that cancer that can cause leukemia to show up. There are also certain genetic disorders that play a role, such as Down syndrome. People with Down syndrome tend to get leukemia easier than other people. Other things such as like exposure to chemicals that can also cause you to be at high risk for leukemia. And people that usually get it from chemicals is when they work with benzene and they work in the chemical industry. These people tend to show up or get leukemia easier. A big factor that increases the risk of getting acute malignant leukemia is smoking cigarettes. And this is a pretty big cause. And then the last kind of risk factor that I want to talk about is other family members. So it could be like a genetic thing where you get it from your bloodline. So, and then basically just to end it all off, leukemia is a very, very common type of cancer, and it can be very deadly if it is not treated early. And if you have to make sure that you don't oversee if you have symptoms, if you have stuff going on with your body, make sure you don't overlook those symptoms, because those could be symptoms of leukemia, but you might think there's symptoms of something else, because the symptoms for leukemia are very common in other things. It basically, like I said, it starts up in the bone marrow, and it can be very deadly if it's not treated early and not diagnosed at a very early stage. And there are many types of treatment that you can receive. So if you are diagnosed with leukemia, I advise you to do some research on the different forms of treatment and figure out what's best for you. So with that all being said, that was my presentation on leukemia, and that's it.